Hi everyone, welcome to my video journal. Today I'm going to be talking about the protest psychosis and describing a patient named Alice Wilson. So Alice Wilson, right, was a white lady. So it was a white lady whose hospital records show a detailed clinical idea of what meets the core criteria of schizophrenia today. And her symptoms were delusions and hallucinations. She displayed them constantly and had very much paranoid delusions and had auditory and visual hallucinations. While she had a severe depression as well, that can follow through with being a psychosis. Hers were definitely very much long-standing, and they didn't, they were not just fleeting. Secondly, she had very disordered thinking, and she had a difficulty with logical thinking and communication, according to her charts. This is a classical thinking disorder as described, and it's really one of the main key symptoms for diagnosing schizophrenia. And then thirdly, Alice had very inappropriate emotional responses, and she was very much socially withdrawal from society, of course, and showed a lot of negative symptoms that fell under the diagnosis of schizophrenia. And in my view, her symptoms were so continuous. It was very chronic, and you could see it, like, from the book's description, a constant decline of her health, her mental health, and it was a recurrent symptom, which ultimately points to schizophrenia and less of melancholy, I think the word is. But comparing her case and Octavius's cases, you could see there was a societal bias and or social factors that were following racial anxieties at the time, and that affected people during the civil rights movement. It influenced psychological diagnoses and treatment. Alice was receiving a very standard care versus Octavius, who was an African American man who was receiving very coarse treatment, and his political activism was pathologized as a protest psychosis. So we could see a stark difference, right? Alice, a white woman from a standard background, presented her symptoms of social withdrawal, paranoia, and she was diagnosed with melancholia, and she received therapy and was on less invasive medication, versus Octavius, an African American man who was involved in the civil rights movement, had similar symptoms of melancholia, but his political beliefs were pathologized and led to be paranoid delusions, to be described as paranoid delusions, leading to being diagnosed with schizophrenia, paranoid type, and he had more corrosive treatments. So then we go on to describing the treatment of isolation, the treatment being described as isolating him. And in the book, he talks about uh, how Octavius was getting sedated, and in Protest Psychosis, he also really argues and passionately describes how the diagnostic change of a similar case of a patient named Caesar, and how his psychopathic personality disorder suddenly shifts to schizophrenia. And he says this was very suspicious, being because his clinical symptoms remain the same. It's just the label changes, right? So, the definition of schizophrenia and the DSM-2, and the psychiatric practice that was happening, shifts to the definition shifts to include hostility and aggression, and then it was often racialized and used as a weapon towards the civil rights movement, and then that in turn changes how drug advertisements are, and how the diagnostic criteria changes. So this is just how clear and simple we could see how social biases and not just symptoms influence psychiatric diagnosis in the mid 20th century. That's all, and thank you for watching.